Usually, whenever we see topper interviews, we get motivated by their success, and we would also want to achieve that. We understand that there has to be a certain amount of hard work, sacrifice, and intelligence that is required to achieve or reproduce that kind of similar success. But at the same time, we can't help but realize that we are also feeling demotivated or scared to see that most of the toppers, they use multiple platforms or are a part of multiple coaching programs to find that successful rank. So today we have with us a topper, a unique topper, I would say, who has stuck to one source for 2 long years and has achieved a 2-digit rank on his first or very first attempt for a postgraduate entrance exam. Now he has fought all the mental battles and struggles and anxiety of the fear of missing out on other resources and other coaching programs, but he has stuck to it. He has trusted the process. Today with me is Dr. Monthan, who has secured rank 73 in November 2022 INI-CET exam, and which is an amazing rank, especially coming from a part of the country which usually does not secure such amazing ranks. He's from the northeastern part of our country, and he has made everyone in his family, as well as all the teachers who has been behind him and guiding him, very, very proud. Hi, Dr. Monthan, how are you?
Hello, sir. Thank you so much for the wonderful introduction. I'm very good, sir.
Right. So let's just not waste time. We all know that you have secured rank number 73, and we know that you have only used one source, that is Marrow, to achieve
Yes.
that. I want to understand, when did you start with Marrow and why did you choose Marrow? Because there are so many platforms out there. I want to understand why you chose Marrow and when did you start with Marrow?
So I was in my third year. All my batchmates had actually joined some offline satellite courses. And definitely at that time, I had the FOMO, that fear of missing out, that whether I should join a coaching or not. But I have decided, like in my mind, that I'll be joining a coaching in my internship and start with the NEET PG preparation. Actually,
So you
Northeast
already
students,
thought of it, I will start in internship, not before that.
yes, sir. Yes, sir.
All
And
right.
the
Okay.
Northeastern students usually have the habit that they'll start their NEET PG or INI-CET preparation a little late because they have also got like a 1 year rural posting after the internship.
Okay.
And so I was having little fear of missing out. So I definitely didn't let the FOMO like affect me much. So I had in my third year, I had the review books of the Marrow teachers like Manisha ma'am and Utsav Bansal sir, and I was using that. So I was actually using the books by the Marrow teachers. Although I didn't join any coaching platform at that time. So it
Okay.
was lockdown. In the year 2020, I was in my fourth year and I was trying, and there was lockdown, and I was trying to cover up my syllabus on my own because there were no offline classes or any clinics. So one fine afternoon, I was just scrolling through my YouTube and I came across Sakshi ma'am's OBG video on PCOS. It was just a video of around 20 to 30 minutes. And has explained the topic in such a simple manner, and the so like I was just astonished. So the very same evening I called up my mother that mother, like mom, like I'm planning to take up a coaching to give me that extra push. And the very same evening I remember, okay, my mother told me, yes, yes, please, whatever you feel like you can do. So I just joined the coaching. And also like the very same evening I joined the coaching and ordered the notes as well.
Okay, so in your fourth year, that was in the lockdown, you
Yeah,
purchased the Marrow
yeah,
Plan
yeah.
C. How many years
Yes,
did you
sir, plan
purchase
C.
it for?
I purchased the plan for 2 years, sir.
All right. Now, once you got it, what did you do? I mean,
Yes,
you must have gone to the videos. What was your feeling
yes.
when you saw the videos?
So that very evening, I started with medicine videos by Rakesh Nair in Marrow. So watched the lectures one after the other. Like I started with respiratory medicine. Like I finished pleural effusion. I started pneumonia, then tuberculosis. One after the other, I just kept on watching, and it was just like Netflix series. So I watched the videos till that night I slept very late because I that very evening I watched around 10 to 12 videos, and I was so amazed. Like sir teaches the topics in such a systematic way and breaks down the complex topic into bits and pieces and which are so easy to understand, and I couldn't believe that, like, how can the topics which were very difficult to read on our own seem so easy. And so I was so happy. So that night, whole night I was wondering how on earth was it possible? So I thought that why didn't I join Marrow when I was in my first or second year? So I was completely like amazed with sir's way of teaching. Then
No, it's
the
okay.
very
I
next,
understand. I understand. I mean, Dr. Rakesh has a
hmm,
wonderful way of actually
yes,
discussing the clinical case with you and then
yes, sir.
beating around the permutations and combinations to come to a
Yes, sir, yes, sir.
diagnosis and why it is and why it is not. It's wonderful. It's like
Yes, sir, yes,
watching a very, a mystery thriller to understand how
yes,
he
sir.
comes to a diagnosis. How was your professional exam like? Was it helpful in your professional exams?
Yes, sir. It was so helpful. So, in my university, there are 800 students, sir, and all of us gave the exam. And I got university rank one that in the year 2021. So,
That's amazing.
and that actually rank one, and I was also awarded with the best MBBS graduate of the year 2021. And that actually had built a strong trust on Marrow. And I never thought about that, and I never thought that okay, I should join any other coaching institute or any multiple coaching institute, because Marrow had completely built a rock solid trust
Right.
to
So
me.
because you found success with Marrow on your
Yes, sir.
professional exams, you were
Yes, sir.
not wavered, you were not confused about its authenticity, about its
Yes, sir. Yes,
top-notch
sir.
quality. That's why you
Yes,
were
sir.
not very worried about other
No, sir.
platforms and other resources. I
No, sir. I
understand that.
never gave
Now,
a second thought, sir, that I should join any other coaching institute. I was
that is
very
awesome.
happy
That is,
with Marrow.
and this is a very important takeaway for students who are confused. I mean, you have to trust the process. See, if I keep telling
Yes,
you,
sir.
you have to trust the process, you have to trust the teacher, you have to trust your notes, you might not believe me. But if you see this person, Dr. Monthan, achieve this kind of success by one resource and one platform, and that is something that you can reproduce on your own. Now, let me understand this one thing, Dr. Monthan. In your fourth year, what were the
Yes.
subjects that you finished before your exams?
So in my fourth year, I have finished all the major subjects as well as most of the minor subjects, along with the Q banks.
So, what do you mean major subjects?
By major subjects, I mean medicine, surgery, OBG, and pediatrics. And
So
minor
final year
subjects,
subjects you finished in final year.
yes, I finished.
And what else?
Then I have, along with that, I have also finished the subjects like anesthesia, radiology,
All right.
dermatology,
So
all the minor
final year
subjects, sir, I
major
have finished
subjects in
altogether.
short subjects, most of them you would have
Yes, sir.
finished in the
Yeah,
final year
most of them,
exam.
sir. Around 80 to 90% of the fourth year
So you
subjects I
watched
have
all the
finished.
videos?
No, sir. Like initially, sir, of medicine, OBG, surgery, and pedia, I have watched most of the videos, sir, 80 to 90%. But for minor subjects, sir, I didn't watch all the videos.
Okay, so you
I've
just
read only
referred
the
to the
notes, sir.
notes.
Yes,
Right,
sir. Yes,
perfect.
sir.
So by the end of the final year, you would have completed everything that was necessary for your
Yeah.
final year exam.
Yes, sir. Yes. Along with the
Right.
Q bank, sir.
Along with the question bank. So the video
Yes.
slash notes and the question bank
Yes, sir.
was done in the final year itself. What about
Yes, sir.
internship? How is your internship in Assam?
So it was towards the end of April 2021 that my internship had started, and it was very hectic initially, sir. And like most of the days, I had around 16 to 20 hours duty in my medical college, sir. And after that, in my internship, I decided that I'll begin with my first and second year subjects. So I started with my first and second year subjects. Initially, I had the habit that I used to watch the videos, and after that, I used to go through the notes. But when the duties got when the duty, I realized that duties were so hectic and I couldn't finish my first and second year subjects. So I thought that I should make a change. And so what I did was that I just went through the notes, and whatever I found difficult or anything which I wasn't able to understand, sir, I again went back to the Marrow videos, and I used to watch the videos to make my concept clearer.
Right. So, since if internship is hard, you might not
Yes,
find a
sir.
lot of disposable time, and whatever time you
Yes, sir.
find, you
Yes.
would want to sleep and take rest. So,
Yes.
you just started with the videos and then immediately realized that it's not something that you can achieve with the
Yes.
limited time that you have. So, you
Yes, sir.
moved on to the notes, and you would only go to the
Yes, sir.
videos whenever necessary, and there is something that is
Yes,
stopping.
yes, sir.
Now, let me understand this. Has Marrow helped you in internship as well? With your clinical cases and patient management, was it helpful then?
Yes, sir. Yes. Yes, sir. Definitely. I used to carry my Marrow big books with me. Like I used to carry, like suppose there was a OBG posting going on, I used to carry my OBG notes. Whether it was when it was medicine, I used to carry my medicine notes. Like that, sir. I used to carry my notes. And in my free time, I used to read those notes. Like one, I still remember a case. I used to participate in the rounds, and in one medicine round, there was a case of there was a case and whose ANA profile had shown that it had anti-Q antibodies positive, sir. And in my background, sir, in the mind, I thought that, sir, I actually had read this somewhere, and it was the like overlap of systemic sclerosis and SLE. So I went back immediately to my notes that day, and I found that, so like it was yes, whenever it was anti-Q antibodies positive, there was an overlap of SLE and systemic sclerosis. And I went back to the PG and told him that this is a case of overlap syndrome of SLE and systemic sclerosis. And like this is one of the incident which happen in medicine posting. And similarly, like whenever like in my casualty posting as well, whenever suppose a patient of femur fracture came, and it was our as interns duty to put two cannulas, then run the drip set and all. Like in my backdrop it used to run that, okay, we have to do this immediately, because a bus has thought that like one, like in femur fracture, like there is approximately around 1.5 liter blood loss. So like things, Marrow made the things so simpler, and this shows that Marrow notes and Marrow that the what the teacher teaches, there is a lot like it stays in our memory for a long time, because I have not read about I have read about anti-Q antibodies like 2 to 3 months ago, and it was still there in my mind. Similarly, like the amount of blood loss, which also is an MCQ question, that was also in my mind. So Marrow has definitely helped me very much during my internship.
That is such a lovely anecdote
Yes, sir.
of what happened to you in your day. Because see, every teacher who's teaching on Marrow is actually bringing their
Yes,
clinical experience, their clinical perspective to simplify things for you. You see,
yes,
everything that we teach, or all the information that we share with you on Marrow, is basically from standard textbooks, and we are actually
yes,
not reinventing the wheel. We are not teaching you something that is beyond that, but what we are adding to it is an ingredient that is very personal to us. It's our touch.
yes,
It's what we
yes,
have experienced, is what we have felt, and that comes from many years of cumulative clinical exposure that all the teachers have. And when we tell you that this is something that we have seen, and that is the same thing that you will also end up seeing in a patient, and that is something that you can relate to and remember for a very long time, rather than just reading it from the book. It's like a personal professor sitting to you and telling you that this is what happened in my life and this is what you will see in a patient. It's such an interesting thing. I wish I had these kind of things when I was preparing. Now let me understand this, to bring things into perspective about your timeline of preparation, because you
yes,
prepared for 2 years and you
yes,
got a two-digit rank. So in your fourth year, to get things straight and make people
yes,
understand, in your fourth year, you finished all the fourth year subjects, the
yes,
videos, notes, and the question bank. Now, in your internship, you started with your first year, second year, and third year subjects.
yes.
Now, by the end of internship, can you tell us, in terms of percentage, how much syllabus was completed?
So towards the end of internship, I completed around 60 to 70% of my syllabus.
So 60 to 70% of your
Yes,
syllabus was complete towards the end of internship when you started
yes,
in your final year. So it is possible.
yes,
So finishing Marrow is possible in final. If you start in final year, and by the time internship comes, you will be able to finish in your Marrow videos, notes, and the question bank. Lovely. So that is reassuring. Another thing I want to know is, when did you start giving grant tests?
so I started my grand test like I had after my internship. I had the rural posting in Assam, which was compulsory for 50% reservation in Assam Medical College PG
Okay.
seats. So after
Okay.
I completed the remaining 30 to 40%, whatever I had left, I left and started with the grand test.
All right. So towards the end of internship, 60 to 70% of your syllabus was complete, and that is when you started taking the grant test,
Yes,
right? So what was your
yes.
first grant test like? Because every topper that we hear always finds the first grant test difficult. What was your grant test like?
So the first grand test which I gave, like after the results came out, I used to give my grand test on Sundays. So I gave my grand test on Sunday, and next day morning I woke up, and at 10 a.m. I checked my rank, and it was 57. I was very shocked, because most of the toppers video which I have watched, like most of them, I think maximum of them. mm, so it was, they always say that first GT scores were very poor, and first GT ranks was very bad. It was in thousands. And in contrast, I had rank which was a two-digit rank. I got 57, I think, and I was completely shocked. So I again reviewed. I went back to the toppers videos again, multiple videos I have watched that day. Okay, I was shocked. How is it possible? Okay, but I thought that okay, I think I have to give multiple more grand tests to realize whether it was something the rank was real or whether it was just like the test
A
was
fluke.
easy. Okay,
Right,
so
right. So, what was your situation with Grant Test? You started giving Grant Test after your internship every Sunday. Is that so?
yes, sir. Most of the Sundays I used to give my grand tests, and in the span of like 4 to 5 months, I gave around 6 to 7 grand tests, sir.
So every 15 days, let's assume.
Yes,
Now,
sir. Yes.
what would be your strategy for grant test? Because a lot of people say that it is very difficult for them to review the grant tests. Sometimes they get
Yes.
the answers correct by luck. They don't understand what
Yes.
to do with it. They get disheartened if the scores were less. What was your strategy with the grant test? A typical strategy for your grant test?
Sir, I used to give my grand test on Sundays, and then the results used to come by Monday. So, sir, there were first of all, I made a mistake notebook, sir. And first of all, I used to review all the mistakes, whatever mistakes I made. And over a period of 7 days, I used to review all the questions. And usually started first of all with the mistakes, and then the questions which were like little bit tough. Like I used to realize, okay, this question is easy. I used to skip that, and I used to switch to more tougher questions, sir. But over the period of next 7 days, I used to review all the 200
So that is
questions.
a very smart way of looking at it. No, so grant test kar lo, and the whole week you will dedicate to part of the day revising or reviewing
Yes,
the grant test. Right? That makes
yes,
sense. Makes sense. Now, so this mistake book that you made had all the
yes, sir.
information from the mistakes that you made in the grant test only, nothing
Yes,
else.
sir.
Right?
Yes, sir. Yes, sir.
Right.
Like
So
suppose I used to make a mistake, sir. I from the explanation, whatever point in and around the topic was necessary, I used to write it down, sir.
okay. So was this book handy? Were you able to use this book later?
Sir, actually, I was preparing for next year, that is 2023 NEET PG or INI-CET. So I thought that
Uh-huh.
I'll be revising it by that time. But
But you
I
you
didn't know
cracked it
that.
before that. You cracked
Yes,
it
sir.
way before that.
I couldn't
Anyway,
revise it, sir.
that's your grant test strategy. I understood. Now,
Yes,
what
sir.
about your revision strategy? You see, most of the students when they start preparing, they are
Yes, sir.
enthusiastic. They have the energy, they
Yes, sir.
have the motivation and the discipline
Yes, sir.
even to start. And a few weeks into the preparation, they realize what they have read in the beginning they have forgotten. They are starting to forget, so they lose confidence, and then everything goes all over the place. What was your strategy for revision? How did you plan your revisions? Were you रिवाइज कर लो फिर आगे बढ़ो और पहले पूरा खत्म करो एंड देन वी विल रिवाइज व्हाट काइंड ऑफ अ स्टूडेंट वर यू एंड व्हाट डिड यू डू
So first of all, I finished my syllabus after my internship. So 100% syllabus is over. Then over the period of next 60 days, I completed my first revision. Then Marrow had emailed us the revision notes. So after the first revision over a period of 60 days, I used to I revise my revision notes over a period of 12 to 15 days. So that is my second revision. Then third revision was again the Marrow main notes. It was a period of I think 38 days, sir. And fourth revision I completed in fourth revision was the revision which was before my INI-CET INI-CET final exam, sir. So it was like in 10 to 12 days I finished my fourth revision. It was
so
revision
let
note
me get
revision.
this straight and rephrase it for people. So you
Yes,
did four total revisions after you
yes,
completed
sir.
your syllabus, right?
Yes,
So first revision was reading the notes again and that took you 60 days, that is 2 months.
yes,
Then you revised the revision notes that you got from Arrow and it took you roughly around 12 to 15 days. And
yes,
then you went back to the regular notes that you made, and this time it took you 38 days, and then you went back to the revision notes, which again took you a period of 2 weeks. So good, regular notes, revision notes, then regular notes again, and then revision notes again. So
revision.
this is the
Yes,
kind of revision that you did, four revisions of your notes. Now, but I want to understand this. See, once you finish everything and then you start revision, so usually what happens is subjects that you started in the beginning will take a lot of time to revise. What was your long term strategy for revision? Would you revise each subject as you finished it or each topic as you finished it? How would you keep in touch with the subject throughout your preparation? Because 2 years ka preparation, you can't
yes,
start revision after 2 years has ended.
yes.
What was your strategy for revision like throughout?
So when I used to like read my subjects during my internship, suppose I read a subject A and I finished in a time period, I finished subject A. Then I used to start with subject B. So then when I used to read subject B, I made sure that there is a definite time allotted for the day for subject A again. Like it can be 1 to 2 hours. I used to
Okay.
read. similarly it went on like that. Like whenever I read subject C, I used to read subject B. Like it can be for one
Okay.
to two
So
hours.
whenever you
But
would move on to a newer subject, you made sure
yeah,
that you went back to the previous subject and revised it at least in a
yes
few
sir,
hours
yes sir,
every day. Right. That is
yes sir.
perfect. That way, you stay in touch with the subject. Otherwise, you tend to forget it. Right. So you started your revisions, you finished your revisions, and the big day, the NEET PG day comes. Right. But you have not appeared for it. Why is that? Why
Yes.
didn't you appear for the NEET PG 2022 exam?
Sir, I was in New Delhi at that time. I was diagnosed with keratoconus. It was mild keratoconus, but the disease was progressive. So I decided that on 15th May, I will undergo a corneal cross-linking surgery. Uh, so on 15th May, I had the corneal cross-linking surgery in New Delhi, sir. So after that, okay, I told my mother, after the surgery was done, I told my mother that, okay, let's go back. I have need PG. Although there was some like pain, some foreign body or itchy sensations were there in my left eye. Only in single eye, I had my operation. So, but the next following day, I had mild anterior uveitis as well. And there was also a checkup post 7 days of the surgery. So I told my mother that let's go and give the exam. My mother said that okay, no, health is of course more important. I should stay back, and exam can wait, and there is always a second chance.
Right.
So my
So
parents, my
I
mother,
understand
sister,
that you
all,
went for the
yeah,
surgery before the exam. Now, I know it
yes, sir,
was not necessary for you to go ahead
yes,
and
sir,
take the surgery. You could have appeared
yes,
for
sir,
your exam instead of the
yes, sir,
surgery.
yes,
But
sir,
at the same time, also realize that this exam, this NEET PG, was not the exam that you were actually preparing for. You were actually preparing for the 2023 exam, isn't it?
yes, sir, yes, sir.
That is the
And
reason
one
you
more,
the surgery.
yes, sir. And one more thing was there that in like Assam we have 1 year compulsory rural posting, and the counseling was there in like 25th May or something like that, sir. So if counseling and joining date was there, sir, in 28th or 29th of May. So if I would have joined my duties, my rural posting, I couldn't have undergone the surgery, sir. So that's
Right.
why
So
like
it
I had
was
to
it
undergo
was
my surgery.
necessary for you to take that surgery
Yeah.
and to get the surgery done before the exam. I understand that. So
Yes.
obviously after the surgery you couldn't appear for the exam. Then what happened? Did you see the paper? What did you feel? Was it easy? You could have done it.
So definitely, I was disheartened, so completely. And my mother was there who definitely supported me at that time. And I became more disheartened after I went through the recall questions. Marrow had uploaded most of the question, and even various coaching institutes have uploaded the recall videos. I went through that, and I found that yes, I could have given the exam, and I would have got a good rank. Sir. I definitely felt that.
I understand that, but it was important for you to get the surgery done. But
Yes.
nevertheless, I think that actually helped you propel yourself further and push yourself further
Yes.
and motivated you towards this
Yes.
November INI-CET exam. Now, from May to November,
Hmm.
what was your strategy like and what did you do?
So post surgery, I didn't wait. I wanted to get back to the track. So post like with with the eye patch on for like 1 week, sir. I studied with my one eye only. I studied. I started studying, sir. I studying. I had my iPad with me and I started studying. So then I joined my rural posting, and I was university rank one, so I had the independence to join a hospital which had the least number of duties, and so
Awesome.
I joined one. And even the OPTs out there used to be managed by community medicine interns of my medical college. So I
Okay,
joined that.
perfect.
So weekly I had 2 days duty, and in non-duty days, I used to wake up as I used to work. I used to study late nights. I used to wake up at around 9:30 a.m. and I used to start studying by 10 a.m. And morning time I used to study from like 10 a.m. to evening 4:30 a.m. And
Okay.
same after a power nap or something like for 1 hour. Then I used to repeat this. I used to start studying again from 6:30 p.m. to like night around 2 a.m. So
Awesome. Awesome. Now, what about
yes,
social media, engaging with your friends, family,
yes, sir.
partying,
Of course, there were
anything?
in between. There was time for lunch, my dinner. I used to talk to my family over my phone, and social media had actually definitely social media had helped me because I used to follow all the Marrow faculties, the Marrow platform as well. They used to upload uh, so many updates, so many MCQs. I used to solve them, sir, on my own. Like I used to comment also, like this answer is B, this answer is C in the comment section. Then definitely there are many interesting medical pages to follow as well. They provide us so many interesting information, and these pages also help me, sir, to like recall the things and reproduce it in the exam, sir.
So you did use social media, but only for your
Yes, sir.
educational purposes,
Yes, sir.
not for
Education purposes, sir.
dopamine kicks.
No, sir.
Okay. So your preparation was over. Then you started your rural
Yes,
service, and in your rural
yes,
service, you just focused on revising everything that you had prepared for,
yes, sir.
and then you went to your INI-CET exam.
Yes,
What
yes.
happened in INI-CET exam? How was the exam? Did you write any mock exam before the INI-CET?
Yes, sir, definitely. My all my friends used to tell me, like from different medical college, not just my medical college, that okay, Marrow mock is something that we should give because Marrow mock ranks are something which actually reflects our real time rank. Because I still remember this Marrow INI-CET mock test 2022, 25,000 students gave, and even in the same INI-CET November 2022, 25,000 approximately 25,000 students gave. So the number was same. So in Marrow mock, I got a rank of 154. That definitely reflected my rank. I got a rank which is much better than that. That is 73, almost half of that.
Awesome, awesome, awesome. Now, I want to understand one thing. One thing that you have told us very nicely is that even though it feels like Marrow is voluminous, it has a
Yes,
purpose. The purpose is to simplify your revisions and recall to answer
yes,
MCQs. That was nicely said. Another thing I want to understand is Marrow, I believe, is the only platform that updates its content year after year, every year. And we have been doing it
yes, sir.
since Marrow 3, 4, 5, 6, and hopefully 7 now. So what is your concern here? Because some of the students, they tell us that, as the Marrow version is upgrading, the information is changing, so they will have to start all over again. How has it impacted you? Because you've been with us for a very long time. You have seen Marrow 4, you have seen Marrow 5, you have seen Marrow 6. How did you manage this edition change of Marrow?
When I joined Marrow in the year 2020 June, it was edition 4, sir. Then it gradually shifted over to edition 5, then to 6. Again, there was FOMO, but I didn't let that affect me. Like all my friends, they again bought, like someone who bought edition 4 notes, they ordered edition 5 notes again, and some of them even ordered edition 6 notes again. But I didn't let that. I didn't want that to happen to me. So what have I done? Because this edition 4 notes, I had added so many points to it, sir, that I didn't want to change it. Those printed notes seemed like I had written the notes myself. And whenever like new editions came, sir, all the Marrow faculties in their social media handles used to update us, like which videos to rewatch again, what are the recent updates. So I used to jot them down in my notes again. And even while solving the new question banks, like new additions in the question bank, whatever was there, I used to just put it down in my notes. I used to write it down in my active spaces. So definitely that change of addition didn't affect me much, sir.
Awesome. Awesome. This is something that I want to reemphasize here. Even though we upgrade our content year after year, because that is what should be done. Information
Yes,
keeps on updating. As a doctor, you should update yourself or upgrade yourself. If you don't, you will perish. You will be destroyed. You will be lost. So you have to
yes,
bring in the new change for the betterment of the new students who come in. But that does not mean that everything is going to change overnight. It is the information that is fine tuned, that is the new information that we add as updates. It's not something drastic. That's not a paradigm shift of information. What you need to understand is these updates that we talk about in the newer videos or the newer editions are something that we will share individually also and tell you that these are the videos that you should focus on, number one. And even if we don't do that, if we don't find the need to do that, the information that is necessary for you will be added to the relevant question bank or will show up on your grand test or subject wise test. So there is very less chance that you will miss it, even if you're stuck with the olden edition. So don't worry too much about it. Start your preparation in whatever edition or whatever part of journey you are, and slowly upgrade yourself as you proceed towards the exam. Now, I want to take a step back and wrap things up and finish this interview with you. I want you to imagine you are joining MBBS now as a fresher yourself, and I want you to tell yourself, the junior self, the young self, what are the few things that you would want to do or keep in mind to make this whole journey easy, less painful, and to find a similar success that you found now to your junior self. What would you tell yourself?
First thing that I'll tell myself is read standard textbooks. Then I would have joined I joined Marrow in first and second year itself, because the amount of effort, suppose we have to put 100% effort to read a subject, Marrow would have reduced the amount of effort necessary to read a subject to 50% and even less. So, like, we have to hammer less to understand a topic. Marrow faculties are so awesome, and I am forever grateful to them that they have helped me so much in my journey, and and getting such a great rank in INI-CET in my first attempt. I'm so thankful, and also, sir, I'm thankful to you, sir. I used to watch your YouTube videos so regularly. Like, sometimes my Grantis score became stagnant. I still remember I watched your video to improve how my Grantist ranks. So I'm definitely thankful to you as well. And Marrow is
I'm
like
so
an
happy
excellent
that you are our student actually.
ma- yes. And Marrow is an excellent educational tool, sir, and it will definitely help us be better physicians, sir, in future.
I think that is the end goal for all the teachers who teach on Marrow platform. Our end goal is to definitely, help you find a top rank to secure the seat of your choice. That is one goal. But apart from that, the bigger goal, the bigger picture that all of us have is that we all want you to be the best of whatever you do. We want you to be a best clinician, a better doctor for the patients that you're going to treat in the future. And that is why when all of us come and teach you, we don't only teach you, this is the MCQ and this is what you should answer. We teach you what is the problem and how you should address that. And you might not believe me, every teacher who teaches on Marrow puts in such amount of effort. It's beautiful, it's inspiring. For to teach a subject of 25 to 30 hours, we put in months and months of hours to record it and to impart that information. And it is so wonderful to see someone utilize that, materialize it, and then convert into a great rank and a great practitioner. I wish you all the best, doctor. What is the specialty that you're going to pursue now?
So medicine.
Awesome, awesome. And I'm sure you will be an amazing physician with the knowledge set that you have, and you will make everyone in
Thank you
your
so much.
family and your surroundings very proud of you. I wish you all the best
Thank you.
and have a great day. Thank you.
Thank you so much.